Welcome to The Explainer. Today, we're going to demystify lymphedema. It's a chronic condition that's often really misunderstood. So we're going to break down the absolute gold standard methods for managing it.
Okay, so here's our game plan. We'll start by really getting a grip on what's causing the swelling in the first place. Then, we'll dive into the best treatment out there. From there, we'll break down its four main parts, look at what you can do day to day, and finally, we'll talk about the reality of living with this condition.
All right, first things first, what is lymphedema? Well, to really get it, we need to look at this incredible, crucial system in our body that's always working silently in the background, the lymphatic system.
So at its core, lymphedema is basically a plumbing problem. When that lymphatic system just can't keep up with its job, fluid starts to back up. And here's the key. This isn't just water. No, it's a protein-rich fluid that can trigger inflammation and, if it's not managed right, it can cause permanent damage to the tissues.
So where does this come from? Well, there are really two main paths. A small number of people are actually born with a lymphatic system that just didn't develop quite right. But the vast majority of cases are what we call secondary. And that means a perfectly healthy system gets damaged later in life. And very often, it's a result of cancer treatments like surgery or radiation. Now, if it's left unmanaged, the condition actually progresses through some pretty distinct stages. It starts off as reversible soft swelling that you might notice gets better if you just elevate your arm or leg. But without intervention, it can move to stage 2, where the tissue actually starts to harden, and then finally to stage 3, which involves really extreme swelling and skin changes. This right here, this progression, is exactly why getting early and consistent treatment is so incredibly vital.
Okay, so that's the problem. How do you treat it? Well, while there's no cure for lymphedema, there is an absolute gold standard approach to managing it, a really comprehensive program called Complex Decongestive Therapy, or CDT for short. And CDT isn't just one single treatment. It's a whole multi-part program. It's internationally recognized as the best way to manage lymphedema, especially once it's gotten past that initial reversible stage. The whole thing happens in two really distinct phases.
So, phase 1 is all about actively getting that swelling down. You're working intensively with a certified therapist. But phase 2? Phase 2 is just as important, and it's all about empowering you, the patient. It's a lifelong commitment to self-care, to keep the results you've worked so hard for, and to stop the condition from getting worse.
So what does CDD actually involve? What are we talking about here? Well, it all stands on 4 essential pillars of care that all work together.
These 4 pillars are manual lymphatic drainage, compression, exercise, and skincare. Every single one plays a unique and absolutely critical role. So let's take a quick look at each one.
Okay, MLD is not your typical deep tissue massage. It's a very, very precise, gentle technique that helps reroute that fluid traffic jam. A trained therapist is manually moving the lymph from that congested area toward parts of the body where the drainage system is still working the way it's supposed to. The next pillar is compression. And let me tell you, this is absolutely fundamental. After MLD moves the fluid out, compression is what stops it from just coming right back. In phase 1, this means multi-layer bandages, and then in phase 2, you maintain it with custom-fitted compression garments. But compression is not a one-size-fits-all deal, not even close. The pressure level has to be chosen so carefully. For instance, an arm usually needs less pressure than a leg, and a patient who has other health issues might need a lower level altogether. The whole goal is to find the highest pressure that works, but that's also totally safe. Now this is a big one. For years, people were told to avoid exercise, but we now know that gentle, progressive exercise is incredibly helpful. See, every single time your muscles contract, they act like a natural pump, squeezing those lymphatic vessels and helping to move that stubborn fluid along. It's a huge tool for stimulating flow and managing weight.
All right, our final pillar might sound super simple, but honestly, it is absolutely crucial. Meticulous skincare. That protein-rich fluid that builds up in lymphedema, well, it's the perfect breeding ground for bacteria. Any tiny little crack or cut in the skin can become a gateway for really serious infections like cellulitis. So keeping the skin clean, moisturized, and totally intact is a top priority.
So, how do all these pillars actually translate into daily life? I mean, managing lymphedema long-term isn't just about showing up for therapy sessions. It's about weaving these preventative habits into your everyday routine.
These are really practical, empowering steps that can make a huge difference. Simple things like elevating the limb when you're resting, always wearing your compression garment, and being super vigilant about any skin injury.
These can all go a long way in managing lymphedema and preventing those painful flare-ups.
And finally, we really need to talk about the long-term implications of living with a chronic condition like this, because it impacts way more than just the physical body.
The risk of infection is, well, it's significant. Let this number sink in for a second. 20 to 30% of patients develop recurring skin infections. This just underscores why all that meticulous care isn't optional. It's absolutely essential for your safety, because a simple cut can become very serious very quickly in an affected limb.
And the impact isn't just physical. As this quote really highlights, living with a visible, chronic condition can take a heavy, heavy toll on your body image and your mental health. It's a powerful reminder that we need comprehensive, empathetic care that addresses the whole person, not just the swollen limb.
On top of all that, just getting access to care can be a major hurdle. For years, many insurance plans, including Medicare, just haven't covered the expensive, custom-fitted compression garments that are so essential for treatment. Advocacy efforts like the Lymphedema Treatment Act are working hard to change this, arguing that these supplies are a medical necessity, not some cosmetic choice.
So look, while there is no cure for lymphedema, there is a clear and effective path to manage it. Understanding this often unseen system, whether you're at risk or you just want to be informed, is the very first step toward taking control and improving quality of life. Thank you for joining this explainer.